Hi friends. Now today I am here to introduce to you the theme for International Day of Radiology 2019, which we are celebrating today. The theme for International Day of Radiology this year is sports imaging. Now the sports imaging has two words: sports imaging, role of imaging in sports. When you look at it, you think about, okay, maybe the radiologists are being a part of the journey of the sportsmen, or the professional athletes who are playing and running. But many times we forget that today many of us are, because of the entire sports, the entire health awareness and the fitness awareness that we have, many of us are also engaging in things like gymming, running, marathoning. So sports related injuries are a big important part, which radiologists play a very significant role. And that is why the radiological societies world over have decided to keep sports imaging as the theme for this year, so that we can make the general public aware of the role the radiologists play in the sports medicine. When you talk about sports medicine, you think maybe it's primarily about the orthopedic doctor or the surgeons, but we forget the role of radiologist in, diagnosing the disease or following it up, that telling, and we help to reduce the bench time that a sportsman would spend. We do not want the sportsman to be spending a lot of time on bench, because he wants to play, he wants to be on the ground, and that is where radiology helps you to diagnose and prognosticate the injury as well. So let us, today I have selected a very classic thing. One of the most common things that you would see as a radiologist, as the most common sports injury that you would see as a radiologist in your day-to-day life, would be an ACL tear. So I thought I'll show you a classic ACL tear to give you an idea on how it looks like on MR, and I'll give you an idea on what role radiology plays in sports medicine also in the discussion today. So this is the theme for today's DAMS Medicine Unplugged. We have a patient who is a young man with trauma to knee, history trauma, with a popping sensation at the time of injury, followed by swelling. So there's an acute traumatic event with swelling and popping sensation in the felt by the patient. Let us look at his MRI image. So I'm going to look at fat suppressed MRI sagittal section images. I will go from lateral to medial. I'll follow up the images and show you the findings. So when I go from lateral, we go from lateral to medial. You can see the joint is distended. You can see a lot of fluid collection here, which already tells you that some acute event has happened. You can see a lot of fluid in the joint itself. You can see the fibula, which is helping you to know that this is the lateral side of it. When I go forward, more medial, you can see now, I'll point out to you the finding that I want you to see here are these. You can see this hyper intense areas in the posterolateral part of the tibia, as well as the lateral femoral condyle. These are contusions or bone bruises, and this is a very characteristic location. We also call them kissing contusions. This is a very characteristic of ACL tear. Now, the classic thing that happens in ACL when the ACL is torn is that the tibia would have that anterior translation, and this part of the tibia will impact against this part of the femur, and both of them, they develop contusions. And whenever we see such an appearance, we already are, in my mind, I'm thinking of a possible ACL tear in this patient. And this is one of the important secondary signs of ACL tear on an MRI. Whenever we look at ACL tear on MRI, we are looking for primary signs and secondary signs. The primary signs would relate to the ligament itself, which I will show you when I see the ligament, and the secondary signs would be the other signs which tells you the possibility of a ACL tear. One of them is this presence of these classic kissing contusions that you see in the posterolateral tibial condyle and the femoral condyle here. And if I go more medially, let me go more medial for you. So we can still see that contusion here. And when we go forward, now this is the time where you will see the tibia shows this anterior translation with respect to the posterior part of the femur. You can see this anterior translation here, and more than 7 mm of anterior translation. If you see, it's also this is the basis for the anterior drawer sign here. This also is a secondary sign of possible ACL tear in this patient. Now, when we now go further, more medial, Now you can see the primary sign here. You can see that ACL, you can see that T2 bright signal. That T2 bright signal here would mean edema, fluid. You know there is something abnormal here, something acute here that has happened. And the ACL per se, you cannot see the normal ACL that we see. Normal ACL would be that fan-shaped dark ligament. The fibrous tissue on MRI is dark on both T1 and T2 weighted images. This looks bright, hyper intense. So you have that idea that there's some edema here, there's some swelling, increased T2 signal, and look at the contour here. Let me show you there is no ligament here, there's only fluid here, and you see some fibers here, but this is all discontinuity. There's a complete tear of ACL that has happened. You don't see the normal ligament at all. You see fluid, you see swelling, and the remaining fibers, the contour with respect to the Bloomstadt line is also lost, which is again an important direct sign of ACL tear that you see here. The abnormal contour that you see in respect to the Bloomstadt line is seen here. And we go further now, you can see the intact PCL here. The PCL is intact. And when we go further and further medial, we can see there is a possibility of a tear of the posterior horn of the medial meniscus here. So do not forget, ACL tear is often associated with other injuries, and one of the most classic association which I wanted to mention today on the day of IDoR 2019 is the classic O'Donoghue triad. Because that O'Donoghue unhappy triad is a classic triad of injuries that you see in contact sports. When you apply a lateral force on the knee, when the foot is fixed on the ground, that produces that pivot shift mechanism that is responsible for that ACL tear, medial collateral ligament tear, and the medial meniscus tear. So don't forget to look for associated injuries here. That is one of the messages that I wanted you to get through this video today. Now, musculoskeletal radiology plays a big role in the kind of work we do today as radiologists. I would say it contributes to a major chunk of the imaging that we do in radiology. So sports imaging has been rightly selected by the radiological societies worldwide as the theme for IDoR this year, because of the quantum of work we are doing and the quantum of contribution that we bring. Now, in my own day-to-day life, I would see patients with knee, classic that example I took of the ligament injuries or the meniscal tears, very important, shoulder dislocations, traumatic, and that all those recurrent shoulder dislocations, rotator cuff injuries, tendinosis, very, very important part of your day-to-day life, and ankle sprains and those ligament tears, very, very important in day-to-day life in radiology. But do not forget that it is not always only about MRI. High resolution ultrasound also plays a big role, especially for superficially located tendons. There is a definite role in rotator cuff tear of ultrasound. So do not forget, sports radiology is not only about MRI, it has even role of ultrasound in sports imaging. And radiologists today would be considered as a part of the team that the sports medicine is not just about the surgeons and the orthopedics. Radiologists play a big role today. And that role is not just in diagnosis. That role is even in treatment. Like we have things like PRP injection, cortisol injections, which are all done under ultrasound or fluoroscopic guidance. So there's a role of radiology definitely in sports medicine. And there is some people, they forget about neuroimaging. Now there is a big talk about the contact sports leading to chronic traumatic encephalopathy. And that is where, radiologists come into play with the kind of things we are doing in radiology. With the high-end MR imaging is able to show you tiny petechial hemorrhages later on, tiny injuries, all diffusion tensor imaging. There's a lot of, talk about neuroimaging here, so don't forget that here. So India has contributed great sportsmen in the recent times to the sports field and the field of athletes and the badminton. You can see here, so there is a lot of things being done here, and that all has made us all aware of sports. And I can see you, I'm sure you all agree today, many of us are, in our enthusiasm participating in a lot of sports activities, running, marathon, but don't forget the injuries that can happen. So it's a good idea to have proper training when you start professional sports, and be careful is the idea. And that is where, radiology fits into the bill. We This helps you to diagnose the injuries, prognosticate, follow up, and even guided treatments are done with radiology nowadays. So I believe sports imaging is a big part of radiology today. I wish you all the best on this International Day of Radiology 2019.